Good morning. Good morning, Wakefield. So anyways, welcome to our weekly COVID-19 update that we hope to end in the near future, but I think we'll be going on for a while, unfortunately. Joining me today is Doug Lyons from the School Department, Superintendent of Schools, Ann McGonigal-Santos, the Chair of the Town Council, Jen McDonald, our Communications Director. I will tell you that Ruth Clay is managing a clinic in Melrose today. And so she may or may not be joining us. She may jump in. Tom Walsh, our emergency director, is actually setting up our clinic on Monday, February 1st, which will be at the old Converse building or the old American Mutual building for you old Wakefieldians on Monday. And we'll get to that in a second. But before we go, let's talk a little bit about where we are as a community in our fight against COVID-19. So if we could put up the map, please. Thank you. You see, we are circled there. We are still, unfortunately, in the red category, but I will say we are moving in the right direction. On January 14th, for every 100,000 people, if we had a population of 100,000 to compare apples to apples, 84 or 85 of them would be testing positive a day. So that's an 8.5% positivity rate from testing. On January 21st, that dropped to a 6.75% positivity rate, or 77 people per 100,000 a day. On January 28th, see, I'm praying for June, you can tell. January 28th, we dropped down to 58.5, which is quite a drop from the last week's numbers, and at a 5.59% positivity rate. So what all that means, a lot of numbers to think about, but what that means, we are trending in the right direction. So I congratulate the community for working harder, staying socially distanced, wearing your masks, and really, making sure you don't expand your bubble too much. I know it's very hard right now, particularly with the cold weather. But if we keep that trend going, next week, hopefully we'll be in the yellow category. Not that that means a lot, other than less people are coming down with the virus, and that's a good thing statewide. If we could maybe go to the next slide there, that kind of shows the numbers where we are, Wakefield being the second from the bottom. We are trending lower, which is a good thing. And you can see that total tests in Wakefield is close to 46,000 people. So tests, so the multiple tests, obviously we only have 28,000 people in town, but we're doing much better. So I do appreciate how everybody is working so hard. So let's keep it up. It's for a few more weeks, few more months. Then hopefully the warmer weather will go and we can at least get outside a little bit more. But keep your mask on, take care of your elderly neighbors. Don't mix these groups up, because that's really what's happening. We've had no real large super spreader. It's just, a few here, and then it's the whole family gets it and things like that. So please be safe. Before we move on to a couple other things, Jen, why don't you go over something that's very disturbing, the scam that is out there that we've had some calls on. So can we go to that scam slide, please?
Sure. So scammers will take advantage of any situation, and this is something that is very emotional for people, and they're certainly taking advantage of it now. So a couple of tips just to keep in mind. If you get any unsolicited offers via email, text, or phone that are asking you for payment in order to get on a list or to be part of a trial, don't do it. Don't give your financial information over the phone or over email. Never provide passwords, bank account details, or social securities to anybody that you don't know. If you have a question about it, call back. Make sure you get a reputable number and call them back if you're unsure who's calling you. There have been instances where even the state of Massachusetts registration site has been spoofed. They make it look like the real one and will send you a link in an email and then try to get your credit card information. You know, the vaccination does not require a credit card to be vaccinated. They may ask you for your insurance if you have it, but even if you don't, you can be vaccinated. So if you have any doubts, click mass.gov/COVID vaccine, and you can type it in yourself and know where you're going. There have also been instances where people are spoofing the CDC on caller IDs. So it looks legitimate, and then they're calling and asking for Social Security and bank information. It's a scam. So if you have any concerns or want to report something, 617-727-8400 is the Massachusetts Attorney General's office. So, you know, just be very wary of things like that in general, but they're really taking advantage of the situation now.
Yeah. I mean, we cannot stress this enough. There is no charge to you for a vaccine. There is no charge to you to get on a list for a vaccine. So there are some of the more despicable people in the world that are taking advantage. And let's face it, really now that they're taking advantage of is our elderly, who are very nervous about getting in a queue, and we'll talk about that in a second. And they are providing people with their credit card number, their bank account. It is just, I really hope that these people get caught and skewered. I have no mercy for them. It is just awful. So please, and if you have any questions, please contact the Attorney General's office. If you can't get through, contact your local police department, contact my office, because none of them are true. I'm telling you right now. I had a conversation with an 82-year-old woman this morning, told her never to give her information to anybody. And hopefully her husband, my dad, set her straight. So there's nothing that you need to worry about with those things. So let's talk a little bit about the vaccines and what's happening. There's been a lot of consternation about this. There's been a lot of frustration, and believe me, we feel the frustration just like everybody else. We've been inundated for the last few days. So last week, the governor and the state opened up the vaccines to everybody 75 and older, starting on February 1st. And one way I am thrilled that our local clinic is February 1st. In another ways, had it been January 29th or 30th, we wouldn't have all this inundation. But I'm happy that we're taking care of our citizens. So just take that as a joking remark. What has happened is that we have a very limited amount of vaccine. Okay, I'm being very straight with you. We're getting for this clinic on Monday 975 doses. Okay, if there are some leftovers for some others and we can use them, we will. But 975 doses is what we have allotted. That's from the state. The only reason why we have 975 doses is because we belong to a consortium, including the towns of Malden, Medford, Stoneham, Melrose, and Winchester. So our clinic, our Wakefield clinic, is going to be open to people 75 and over from all those communities. Okay, so but that's the only reason how we could get those doses. All right, so the alternative was to get 100 doses just for Wakefield citizens. We did the math and figured we can get more in for that. So that website was set up. The software used to set up this, it's the state sets up the software. It's immunizations.ma.us, I believe, and maybe Jen can put that in the chat so we can see it. There it is. So you go in there and you check the locations and you can log in and put your information. It is very difficult to do. I get it, and particularly for some of our people who are 75 and older, to get into there and do that. So we've been helping people through our Council on Aging. They've done a yeoman's job to help people. We've helped people here. We've helped people through the Board of Health Department. But everybody in the world is calling now, because when the governor said February 1st, they see one of the first clinics that's open for February 1st was the Wakefield clinic. not reading the whole fine print that it's for those communities that I mentioned, Wakefield, Melrose, Malden, Medford, Stoneham, and Winchester. We're getting people from all over the state trying to sign up. So what happens is they go and they sign up in the software. They go in and they're from Worcester, to pick on a community far away. Let's pick on Natick, because Natick, actually, I had an interaction with someone from Natick that was going to show up anyway. No, this is not for people from Natick, and I'm sorry, but this is for that consortium. So they come in, for some reason, the software lets you do that. So every day we've been going through, or more than once a day, and actually removing people that A, aren't in the area, so they don't qualify, B, are not 75 or older, and C, aren't in those other categories in phase one. They're not first responders, they're not healthcare workers. We can only give vaccines to those 75 and over, or people that are in phase one. We've had a lot of very sad stories, and I get it. You know, you have certain physical ailments and you want to bump the list. We cannot do that. It's not our rules, it's the state rules. And it's very hard to get in there, and it crashes. You get halfway through and they dump you out. So we've heard all the stories, and it's awful, and I'm very sorry for the community that that's happened. So at times, our website will shut down, and you'll say, geez, it says there's 20 appointments left. I can't log in. There's no blue button, and there isn't one. That's because those people that shouldn't be in there are being scrubbed out. Or the other part of this is that for some reason, I'm told that our software, for some reason, keeps adding people beyond the doses that we have. Now, I don't know how the back room goes, but really not the best job in the world being run out by the state. So we're on this. We're doing the best we can. We have a full contingency coming on Monday to do this. I'm very proud of our people for putting this together. I'm proud of the support that we've got from the town council to do this, but it's been a trying time, and I get it. I've responded to a lot of phone calls. We all have here. So A, don't show up if you're not signed up, because you will not get a vaccine. Don't show up if you somehow slip through and you are a healthy 28-year-old who put in your name and stuff, figuring you're going to get it. We will be asking for IDs and at the door, and you will be turned away. Sorry to say, but that's the way it's going to be. Not going to sugarcoat it. Things that we're trying to do right now, and then I'll open it up for other comments. We are going to be setting up, we're learning from this, right? There will be other clinics set up. We are thinking at this point right now that any future clinics that we do, because they will be coming up maybe towards the end of this February, middle to the end of February, will be town-centric only. So we're thinking each community in the consortium, while this is going on, we'll do one for Medford, one for Wakefield, one for Stoneham. It'll be much easier and I think simpler for people. And we'll just, instead of doing one every week, we'll do one every few weeks while we're waiting for more vaccines. And we're told they're on the way. Second point I want to make is that most likely, getting a lot of questions about when I'm going to get the second shot. Your second shot should be for the Pfizer vaccine 3 weeks or so after the first shot. We hope to give you, when you get your first shot, that's my hope, a time. The place will be the same if you come on Monday. I'm hoping that the time, date is 3 weeks out, and the place will definitely be the same. That we can tell you that on Monday. That those logistics are being worked out as we speak, but that's what I anticipate happening. So with that being said, I'm going to turn it over to Ann Santos, our town council chair. And if anybody has any questions in the chat, I will take a look at that too, to see the best that I can do to answer them.
Just really quickly, I would echo what Steve just said. Because I think we've been on top of this more than some of our neighbors, and we're well organized. And frankly, this started back when H1N1 virus was popping around, and way back when I was on the Board of Health, and I remember us going through this. So Ruth Clay, she knew how to put this together. Because we're on the ball, we're taking care of our own, and that doesn't sound great, but we have such limited doses that we are taking care of our residents and those that work here. So for folks that are trying to bring in people from elsewhere, I know it's terrible if you have a relative that should be vaccinated from another community. We just can't do it. We're hoping that this will all change in the coming months or so, once the federal government and the state government gets a little more organized. But you know, just please be respectful when you go get your vaccine. And if we tell you you can't get one, you turn away and join the rest of us who can't get one. So just understand that we are doing the best we can and we have such limited resources. We're really taking care of those that are within our consortium and within Wakefield. So I would thank you all for your patience.
Right, and not only are we trying to take care of them, but that is the deal. That's how we got the vaccine. That's the contract we signed with the state. So our hands are kind of tied. Yeah. Another thing that's happening, and I hope that people watch this. People are actually hoarding appointments like they hoarded toilet paper. I mean, I know it's hard to fathom this, but people are signing up, and there's no state database that kicks you out, unfortunately. People are signing up for, let's say, the Danvers Doubletree Clinic, which anybody can that's over 75 right now for February 1st. Getting a slot in there, and couldn't get the first, but maybe they got the 8th, okay? Well, maybe the 8th wasn't that good for them. So they're going to other places, trying to sign up there too, trying to get a preferred time. People, this is not getting your hair done, all right? This is really important. If you get a sign up, keep it. Don't be playing for a better time, because what happens is you're depriving someone else of getting on. It's really too bad. It's really sad. Let me turn over to the schools, and then I'll come back to you, Jen.
Thank you, Steve. I appreciate it. Good to be here this morning, and I agree. We've had a good week this week. It's a positive is that we are trending in the right direction. Our total positive cases for this week are 20 students and 1 faculty member. So we have 21 new positive cases this week. That brings our total since September up to 205 students and 41 faculty and staff. Our quarantine numbers are down compared to where they have been, especially a few weeks ago. We're at 121 students and 6 staff members. So we're pleased that that's going in the right direction. Testing, we are continuing to test faculty and staff on Sunday morning here at the high school field house. It's been very positively attended, and I think it's been well received. I think it's been appreciated by the teachers, and I think it has allowed several of us to be able to feel safe and secure about coming back to school and remaining in our hybrid schedule, right? It just kind of lends itself to a level of kind of psychological safety, just knowing that we're negative, and it has allowed people to continue to come back and be engaged. So the other piece that I need to report is that I'm meeting today with our nurses to talk about pool testing. So the Department of Elementary and Secondary Ed is rolling out pool testing, and we have some questions about that. And I'm also working with the other superintendents in the Middlesex League to kind of see how they're handling that in their communities. And it looks like we're not alone in the number of questions that we have. Our questions really focus on, the use of antigen testing to kind of pick up positive tests after a pool test positive. So there are some significant positives. I keep using the word positive, not to misuse it, excuse me, but there's some significant good things about doing surveillance pool testing. But there are some significant challenges with what the state is rolling out as a program, right? So they're rolling out this program, they're providing resources for a limited amount of time. At the end of that time limit, 6 weeks, schools and districts would have to take on and assume the costs of these programs, which is very expensive. That's number one. Number two, it also intersects with kind of our vaccination schedules. So we're really working with our Board of Health and our town leadership. And all of our teachers are very, very eager, very eager. I can't overstate this. They're very eager to get vaccinated as soon as we possibly can. And so, you know, and for pool testing, surveillance testing to work, groups of people need to participate. And we're really feeling like it's a question mark if after people get vaccinated, would they still be committed or interested in participating in pool testing while we're still continuing PCR testing on the weekends. So there's still some questions that we're working on. We're going to meet with our nursing staff and we're going to make a decision on that, and we'll make that public next week. But thank you for the opportunity to be here. Again, I really appreciate the work that we're doing in the community for vaccinations. And I think that the plan is really as aggressive as it can be. And I think once we work these kinks out in registrations and all the stuff, I think it's really going to start to go smoothly. So thank you very much.
Thank you. Thank you, Doug. Jen?
Sure. So the final thing I had was just about volunteers. A lot of people have asked how they can help, and we have brought out of retirement our former Public Works Director, Richard Stinson. Maybe it's winter, so he's feeling the need to get out there. But again, a logistical mastermind and knows the town really well. So he's really, really great for this. So he is the volunteer coordinator. And I'll throw in the chat, but I'll also give you the URL if you're interested in signing up. wakefield.ma.us/COVID-volunteer. If you go to our regular website, the COVID hub is right in the main menu. You can fill that up. And again, you know, this is going to be going on for months and months and months. So we'll need people over the long term, whether you are someone who has a medical background who's interested in actually giving the vaccinations to someone who just wants to do some administrative work and check people in. There's all kinds of different opportunities. And there is opportunity too to also maybe help out at a Melrose clinic. So you can pop on in there and let Rick know that you're interested.
Jen, put that back up again, if you don't mind. Or Ian. So if you look at that, this is our town website, and I got to say that, you know, Jen's done a fabulous job. There is a lot of good information in there, and particularly if you go down there on the left, vaccine information. We will certainly put everything we can out there. In fact, we're working on a tutorial about how to fill out the form when you go on that Jen's done, and there might be a slight change there, so that's not going to get out. So consult this form. This will have a lot of information on it. This is the quickest way for us to get out information. I hope that next week, if not later this weekend, we will announce the next Wakefield clinic on there and be able to open that up and get people in there. We have 2,500 people in Wakefield, that around 2,500 who are over 75. We need to help them to fill out the form and get certain information, get them in there. It's not really easy. I've done a number myself for people. I know our Board of Health people have. Want to thank them again. I know that our Council on Aging are calling, being very, very proactive in calling our people that really need our services, getting them in there. This is what it's about. This is what a community is about. So, you know, hang in there, stay together, consult the website. Can't thank these people enough. Ruth Clay, Tom Walsh, the town council led by Ian Santos, everything that they're doing. Doug Lyons, the school department, the teachers, our DPW workers, our town hall workers. I mean, these people are all giving a lot of their council on aging workers, a lot of their time, weekends, evenings, nights, trying to do the best that we can for Wakefield. So I'm asking for everyone a little patience. We didn't set up this website. It's not ours. We got to deal with it right now. We didn't set up the software package we got to deal with right now, but we will get through it. So stay safe, stay warm, and consult the website often because things are going to be changing. Anything else to add, anybody? No? Everyone stay warm this weekend, okay? Take care, all right? Thank you. Thank you very much.